Hello, my name is Peter Wu, one of the PM&R providers, and today I'll be talking about the objectives of this presentation are to introduce the therapeutic agents used. Hip pain is a commonly reported primary symptom with many potential causes. Hip pain is a common condition with an estimated prevalence of 7% in men. Therapeutic agents most commonly used for non-surgical interventions to the synthetic corticosteroids used for injections are derivative. The effect of corticosteroids is gradual, and symptom relief may not begin until high hyaluronic acid, or HA, is a high molecular weight visco. Many different preparations of locally injectable HA are available, and they differ. The use of platelet-rich plasma, or PRP, to treat various musculoskeletal conditions. Ultrasound-guided procedures done correctly are associated with minimal risk. Frequency selection for the structure of interest is critical to the selection of a sterile transducer cover, or alternatively a tegaderm, adhere to the. Most of the common adverse events related to steroid injection are self-limiting and resolve. Education for the patient should describe that immediate pain relief may occur owing to. With regard to PRP, specific pre- and post-procedural guidelines. I'll next provide overview of injection techniques for particular pain generators at the hip. With ultrasound procedures, the patient is placed in supine position with ipsilateral. Regarding evidence in the literature, as of a 2016 regarding the efficacy of injectates, intra-articular hip joint steroid. There is lack of agreement among providers and governing agencies regarding the efficacy of. Labral tears can be asymptomatic or result in symptoms of groin, buttock, or lat. The cyst needs to be visualized in at least two planes on ultrasound. The iliopsoas bursa is the largest synovial bursa in the human body. For injection, the patient is supine. The probe is placed in an. Greater trochanteric pain syndrome is characterized by pain and tenderness over the lateral. The symptoms of greater trochanteric pain syndrome can be caused by bursitis. For injection, the patient is placed in a lateral decubitus position with the target hip. The spinal needle is advanced in plane with the transducer beam from posterior. A few RCTs have investigated the efficacy of steroid. The proximal biceps femoris and semitendinosus muscles form a conjoint tendon. Ischial gluteal bursitis can be acute or chronic, with causes that. The piriformis muscle has a triangular shape, with a broad base originating. Piriformis syndrome is a condition referring to sciatic nerve entrapment by the piriformis muscle. The quadratus femoris is a flat quadrangular muscle located posterior to the hip joint. Study results have demonstrated transient but significant relief of the symptoms. The lateral femoral cutaneous nerve is a sensory nerve arising from the posterior division. While denervation for hip pain has not yet gained enough traction to be. In addition to the labrum and ligamentum teres, most pain in the hip joint originates. In the early 1900s, it was found that traumatic or iatrogenic injuries to the. Since then, anatomic studies have revealed the major innervation to the hip. In 2001, Kawaguchi and colleagues reported their experience in a case series of 14. All of their patients were not surgical candidates, either because of comorbidities or. Radiofrequency neurotomy was performed at 80 degrees Celsius for 90 seconds. To target branches of the obturator nerve, the electrode was inserted anteromedial. To target branches of the femoral nerve, the electrode was inserted from below the anterior superior. The authors reported visual analog scale scores before and after. At this time, radiofrequency targets for denervating the hip joint focus on the anterior joint. Because of the variability of the course and number of branches of the articular nerves innervating, hip denervation has the potential to offer substantial pain relief with reduction in. Limitations to the efficacy of hip denervation include the fact that sensory. I hope this talk was able to provide a better understanding of the therapeutic agents used.